My name is Lance Worth. I'm a general contractor, so I'm constantly climbing, lifting, building, driving machines, and I like to go fishing quite a bit. My pain started approximately a year ago with an injury. On a job site, I walked into a boom of a skylift, thought I was low enough. I hit my head directly to it, cracked my neck back real hard. It just started to get worse and worse. I haven't been able to sleep in 7 weeks. I had to sleep on a recliner, almost straight up and down with my arm up behind my head to relieve the nerve pain that was shooting down my arm and in my shoulder. I had to drive like this. I had to on and off throughout the day. I had to do this. And the more I moved, the more I did things, it would free up a little bit. But as soon as I would go to rest, it was like a 10 out of 10 as far as pain went.
Initially, Lance tried to treat his neck injury with conservative treatments, during which he also saw his family doctor, who prescribed him pain medications and injections to try and relieve his pain.
I went and had the normal CAT scan done, x-rays, daily heavy doses of Motrin and Tylenol, and 3 times a week to the chiropractor, and stretching, gabapentin. The pain medications and all the chiropractor visits made it tolerable to work every day. Nothing seemed to do anything, and I just try to get by until it gets to the point where I can't take it anymore. Chiropractors and pills and stuff don't do it. Injections, it's all temporary. I need a permanent relief.
When conservative treatments failed to eliminate his pain, his local doctors recommended he undergo anterior open neck surgery.
Well, I've had chronic back problems since I was 16 with disc herniations. And when they talk about surgery where I am, they talk about 6 months to a year of downtime. They wanted to come from the front. They wanted to remove bone. They wanted to cut my back muscles. It was such a long recovery time. I make people suffer through all this stuff that doesn't work.
Not wanting to endure the hospital stay, long recovery, and health risks of anterior open neck surgery, and as a former patient of the Bonati Spine Institute, he knew exactly who to call for help.
2 years ago, it got to the point where I couldn't walk, and I just started researching the internet, laying there, and came upon Bonati. And when I read about him, I reached out to him and got all taken care of, and I've been working like crazy. And now this injury is my neck, so now I'm back down here from my neck. I knew he was the right guy to come to because it took care of me before.
Lance sent his images in for review, and Dr. Bonati called him personally to tell him he was again a good candidate for the targeted Bonati Spine Procedures.
He called back right away within a day. I had a phone call back, and he said, yep, we can take care of it. And he said, I can get you in this certain day. So I just scheduled the flight on the plane. I was here the night before. I got in yesterday. I had the surgery the same day because they already had seen my films. You couldn't beat that.
Surgical guests traveling from outside the Tampa Bay area are pleased to learn that the Bonati Spine Institute provides them with all the services they need to prepare them for surgery in-house. This includes a state-of-the-art on-campus imaging center.
Going to the chiropractor, taking steroids, the whole regimen of the stuff they always put you through before they'll even think about even doing an MRI. You know, it's just backwards. I don't understand the system. When I can make an appointment here, fly down here, get my MRI done, they read it, I'm into surgery the next day. I can schedule all that on the same trip instead of 6, 8, 10 weeks of suffering. It's so easy here. I've never seen such an easy process between the appointment to the films, to setting up the surgery. Everybody's so professional. You just go right through the line, and I had a really good time. It was a really good experience here.
The exclusive Bonati Spine procedures are performed incrementally using conscious IV sedation. This technique allows the patient to remain awake and communicating with their surgeon. This is to ensure the source of the patient's pain is eliminated before they leave the operating table.
I've had a lot of surgeries in my life. First time I ever had a semi-conscious sedation. It's a little different. You're kind of aware when they ask you how you feel certain things. And like this time with my neck problems, right away, even yesterday, my elbow pain went from a sharp knife to nothing. Instantly. It's the only way to go. I just don't see why people would do anything else.
Lance, how's that pain in your elbow?
No.
Huh?
No.
No? No pain?
No.
Okay. Were you having pain in the arm before surgery?
Yeah.
Yes?
Patients are often surprised by how much better they feel minutes after surgery, and they are not required to wear an uncomfortable brace or suffer through weeks of agonizing physical therapy. Instead, they are told to simply walk about 40 minutes a day.
I was able to do things again, no sitting around, and it's already only been not even a day.
Lance highly recommends the Bonati Spine Institute to anyone suffering with neck or back pain.
Ever since my first round of surgeries, I've been a huge pusher of Bonati, just because of what he does and how he does it. After you research the tech, how he invented the tools, and versus what other doctors are doing. I've told so many people up by us, relatives, friends, of don't go conventional surgeries. Don't do it. Send the films here. They'll tell you what he can and can't do. He's right up front about it, and it's the way it should be.
Lance is looking forward to sleeping through the night and getting back to work, all pain-free.
Get back to normal life again. Get back to just going and doing, and you don't realize how much you're missing when you're in so much pain like that.
To see more stories of recovery just like this, search for the Bonati Spine Institute on Roku, Google Play Store, Apple's App Store, and Amazon Fire TV.